Well, it may come as no surprise to some, but basketball is one of the most popular youth sports in America.
Yeah, but like any other sports, athletes run the risk of injuries. Now with the Big 12 tournament in full swing, we're sitting down with sports medicine trained orthopedic surgeon Dr. Matt Daggett is with us. And welcome back, Dr. Daggett. It's good to see you again.
Thanks, great to be here.
In person, too,
Yes.
and not over a Zoom call.
Way better in person,
Much better.
Way
the
better.
energy is so much better. Let's start out with an easy one here. We'll lob a softball your way
Sure.
to keep it a sports term. What's the most common injury in basketball?
So I see a lot of ankle and knee injuries from basketball. Unlike other sports where you have a lot of overuse injuries, such as baseball, when you're using something all the time. Basketball is definitely more of a traumatic injury type of situation of the lower extremity.
Okay.
Gotcha. Talk about some of the specific treatments for those injuries, because I know medicine has, prevailed and moved on. People can go back to playing basketball after getting injured.
Yeah, and it obviously depends on the severity of the injury and what injury we're talking about, but taking an early approach to injury and rehab and trying to reduce the amount of swelling you get and making sure you have an accurate diagnosis early can really minimize the downtime of an injury. And I think that's probably the most crucial point, is just making sure you know exactly what's going on before you make a decision whether you're going to return to play or whether you need to do some rehab or get some further tests to get back.
Okay.
Athletes want to get back right away.
Absolutely.
Yeah.
I mean, right away.
Yep.
Like give me a week, put some ice and some stem on it, and they'll be good to go, right?
Yep.
Yeah. We saw that with Patrick Mahomes with his ankle.
I was just about to say, we're not
Yeah.
all Mahomes, though, is the problem, right? He's kind of superhuman.
What is the concern about returning too easily? Can it cause further damage?
Yeah, so if you do return to sport too early, you can certainly have an additional injury that occurs, especially if you don't know exactly what's going on. If you have, for example, sometimes if you have a knee injury, you feel that instability of the knee, and if you return back, well, you're not going to play at the performance level you want, but you also could suffer a secondary injury. So you got to be careful and make sure you get the accurate diagnosis early.
Yeah. We know that basketball is a fast-moving sport,
absolutely.
Very high-end, a lot of movement. But how can you prevent some of those knee and ankle injuries, I guess, while playing basketball?
Yeah, so depends on the population. I see a lot of former basketball players, such as myself, and one of the rules I abide by is try to avoid what I call the Jason Gilman effect, which is a friend of mine who, when you're tired and you're fatigued and you know you should stop playing, just stop playing. Don't play that one extra game.
Listen to your body, right?
Because your body's trying to tell you something, and that can certainly cause a second impact.
Okay.
What are athletes different these days? Are muscles bigger, bones stronger, players bigger and taller? What kind of athletes, patients do you see these days?
Yeah, you're exactly right. Everybody is bigger, faster, and stronger. And if you imagine, like on a football field, everybody's moving with more mass and velocity than we have previously. And just like if you're driving a car, there's going to be more damage the faster and bigger your car is if you have an impact. And so we see a lot of those injuries, unfortunately, more and more traumatic injuries, just because people are bigger and faster, and a lot of that collision and contact is, and as you know, basketball itself, it's not like it used to be. It's a much more contact collision sport than previous, and so you certainly see a lot of those injuries.
I'm curious, is there any new technology that you're using today that was not available in the past to help people recover sooner from injuries?
Yeah, there is. So, for example, in terms of arthroscopy, we're using what's called now a needle scope in certain cases, and it's a smaller device that is a lot less invasive, so you don't have to use general anesthesia oftentimes. You can use local. You also allow for the patient to return to play faster and return to activity faster oftentimes, and you don't have to use narcotics with it. So that's a technology that is being used more and more to diagnose things and treat things more efficiently and quickly.
Fantastic.
That's amazing.
Yeah.
Yeah, it's pretty cool. Technology's great.
I have a lot to ask you. I have a bum knee, so we'll talk in the commercial break. But how can people get a hold of you?
We're at Sana Orthopedics. We're in 2 locations, Lee Summit and Leewood, and just here to try to keep people healthy, and if they get injured, get them back to doing what they love.
Yep. Keep the Kansas City Comets healthy too.
Yeah.
Taking care of those guys.
We do our best, that's for sure.
Thanks a lot, Dr. Daggett.
Yeah,
Great
it's
to
a
see
pleasure.
you.
Yeah,
Come back
thank
and
you
see
very
us
much.
again soon.
I will.